Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. We are back this week. We have a guest with us today, Miss Connie, who is joining us. Yes. We're going to dive into all things CO₂, which one's the right, laser for you. But before we get there, Connie, can you tell us a little bit about yourself and...
Connie is a Weiler Plastic Surgery
I'm like, what are you doing?
Yes, I have been here for, I believe, 12 or 13 years. We've lost count. I mean, I don't know exactly how long.
2009, so whatever
was
that
it?
is.
Okay, yeah.
Probably, no, it wasn't 9, because that's when you're probably 10 or 11 is when
Oh,
you
you're right.
started.
It was, yeah, you're right. It was
When did you
2011. 2011.
Yeah, so I think I was like 6 months ahead of you.
She was the first one.
Yep.
Connie is my...
Oh, wait, Connie, you're the original?
She's the original.
Connie is the OG.
I haven't
She's
left
employee
yet.
number one. Isn't that crazy?
Employee number one.
Well, rephrase that. Core employee number one. So I had a few other employees that were very good, but Connie is...
Connie's still hanging in there.
Yeah.
Still hanging in
Yeah.
there. I love that.
Happily, yeah.
She's the kind of person where you build a practice, build a culture around. And Connie is my core employee. So Connie was living in Macomb, right? That's where you're from. You're from originally Macomb?
I'm from Mississippi. Yeah, Macomb, Mississippi.
And I had started...
Macomb, Mississippi.
And I had started in practicing in Hammond, so I just started and I was advertising in Macomb because I knew there was like nothing really going on there, right? And so Connie had a little business up there as an esthetician, and she calls me and she said I was yawning on the phone when I called her.
Very relaxed.
Very relaxed. I'm probably tired. I had 2 kids. And comes in and, Connie's been a business owner. She's driven. She's really into her craft. And she was like, we got to work together. And I was like, can't afford to.
Okay.
And I think we met like 2 or 3 times. I think we met. And like we couldn't, like I was like, I don't think I have anything for you.
Yeah,
to do.
I was determined though.
She was determined. And
I had to work for you. Yes.
And I remember I was sitting in the chair, and she's sitting down right now, but she's petite, and she's like a little spitfire. She's running around like, I got to work for you. We got to get this done. I was like, my
Wait,
goodness.
so was Hammond the original Weiler?
Hammond's the original location.
Original.
It is the original location, and Connie is the OG employee. I built a very successful aesthetic practice with an esthetician, and then to my right, obviously Taylor came in a few months later. Taylor was the same way.
There were 4 of us. Now there's 100 and...
Well, between 2, there's almost 300 people.
Oh my gosh.
So Connie came in, and Connie was like super like, I don't want to use words, like driven and like, we're gonna make this done. I'm sick of commuting to Baton Rouge.
Yeah.
Like, I'm gonna make it work here in Hammond. I don't care what it takes.
Yeah.
Right? And then Taylor, on the other hand, so do you remember this story? So I was living in Hammond. I was rounding or working in a hospital in Baton Rouge, which is about 35 minutes away. And I'm walking through the hospital, and somebody comes up to me. I have no idea. I don't know if you know who it is.
Still thankful for that girl.
I don't know who it
Brandy.
is. Brandy. Okay, she comes up to me and says, hey, you're Dr. Weiler. And yeah, she's like, you're a plastic surgeon, right? I'm like, yeah. She's like, I got someone that you need to meet. I was like, all right. I've got a friend, Taylor Besh, that she's just graduating from PA school, and she's looking for a job, and I think she'd be perfect for you. I had no idea who this person was. Still have never seen this person again.
We're just like,
she writes
shout out Brandy, though.
Yeah, she writes down Taylor's name and number. And so I think in the car, I called you. And you're like, yep, I'll be there Monday or something like that, right? And so this was like a weekend I was working.
You were about to hire somebody. I took an ortho job, and it was like...
All right. And then she shows up, and she was just supposed to kind of like shadow me for a few hours. And so literally, like, I go to see a patient, And Taylor like busts in, like pushes me to the side, puts some gloves on, and gets to work.
And she's been like that.
I don't think that's changed.
But I don't think that's changed. And I was like, I think I told her the same thing. It's like, Taylor, I don't know, but like we got to work together. So
wait,
Taylor,
had you ever injected prior to
No.
that? Was like your first.
I knew nothing. It was literally
you were just
straight
like, I
out
need
of
a job,
Yeah.
and it's definitely not ortho.
Yes, right.
And then the other good story for Taylor. So Taylor joins me, and she was not the injection queen she is now. And so we were like, the original thought was she was going to help me in surgery, right? And so we get Taylor certified, we get her on staff. And so literally, I think it's like a breast reduction or a breast reconstruction case.
Breast reduction
case. And it's, 8 a.m. in the morning. So, you go in and you have to go wash your hands. And you walk in and they dress you, and it's very cold in the operating rooms. And so, but you put on, a gown and gloves and a hat. And so I go up to the patient's asleep. I'm standing on one side, and Taylor walks up, and she looks at me, and she puts her hands down. We're just about ready to cut. And all of a sudden, I look over at Taylor, and Taylor's eyes roll back in her head.
You did not.
And she passes out. The first time in the operating room, she passes out. And so the nurses run over, they take off the gown, they're put a little water on her face, and she wakes up, and she stands up, and she looks at me, and I'm like, Taylor, are you pregnant? And her eyes, Taylor, like,
you were.
like, oh my goodness.
Pregnant for my first kid.
Oh my Isn't that crazy?
God. Crazy. Good story. Yep.
Well, I don't know if you need to be pregnant to be queasy. I watched an Upper Bluff, and I was like,
that's what I
he said, do you need a Coke? I was like, I need to get out of here.
We had worked together for a couple of months. And Taylor was
I loved
She
it.
gets in there and digging around. And so I didn't think she was queasy from the procedure. But
Sure
I was
enough,
like,
pregnancy test later.
Yep.
Here we are.
We are.
4 kids later.
Bam, bam, bam. So
You were like, maybe it's not you, it's me.
Yeah.
It's me. It's definitely me. Well,
but these two ladies are the core of my business.
Yes.
The OG
So
gals.
So you're in for a good treat.
The ones that probably know more about you than your wife.
Yes, probably. Yes.
Probably have
Professionally,
to deal with you. Yeah, like, probably have to deal with you way more on a regular
Yes.
basis. Well, awesome. Well, let's go ahead. We're going to get into it today. This is something that everybody deals with, right? This is just those skin changes, uneven tones, big pores, all that jazz. And we have some things that we can kind of use in our tool belt to help out, which are different CO₂ lasers.
Yep.
I'm excited to talk about CO₂. I think he was using CO₂ long before. I know it's been around forever.
Yeah, well, so CO2 laser's been around for a long time, but it was really very popular. It's like when it first came out. So, lasers, right? So lasers, really all they are is light. And so, we have a beautiful new studio.
Yes, cheers. Hello.
What can you say about
We
that?
can say that. We
Right?
have this gorgeous studio.
Gorgeous
Don't worry.
studio,
It's going to
right?
keep getting better.
Keep getting better.
And we're really excited.
But we've got, and really the difference in this studio is the beautiful lighting that we've got in here, right? And so lasers are really just light. And they're a focused single wavelength primarily of light. And so light, visible light, and I'm not a scientist, but it goes from it's measured in wavelengths, right? And so, it starts at 1 and goes all the way up to 28,000, right? And so visible light is usually around 100 to 200 and kind of ends at around 600, give or take a little bit, right? And so lasers are usually higher wavelength than our visible light. And then it's very, very focused light into a beam, and it's only typically one wavelength. So if you take light and you harness it and you put it in a singular beam, and it's only one wavelength, it can get pretty powerful.
Absolutely.
And typically the higher the wavelength, the more powerful the laser, right? And so, visible, if you go out in the sun and you get sunburned because it's the light, whether it's UV radiation, but it's really basically, we can kind of classify it all as energy and light. And so you can harness that into laser devices and you can affect changes on the skin with that, right? And so the beauty of the CO2 laser, it's the highest wavelength that we use, right? And I think it's around 16,000 or something like that. And so it can be a very, very powerful laser. And so when lasers were originally invented way back in the 40s and 50s, they were all a single beam of light. And so we used to use those in the 70s and early 80s but a single beam of light of CO2 can be really, really aggressive.
It was that and the croton oil peel.
Croton oil peels were big, yeah.
Those two are that's pretty much what they
right?
did. Mainstay.
The original ablative CO2 would
Yep.
leave these lines of demarcation because it was so strong.
So
Yeah.
strong, right?
Yeah.
And so they were shooting this laser, a full beam, and then like it was a long recovery. That's where people get like these 6 to 8 week recoveries.
Yeah. Wow.
These demarcations, these lines, and all this stuff. And so, you know, people weren't. It had a miraculous effect, but people were like, I can't hide in my house for 2.5 months and have my skin peeled off like that. So what they did is they took the CO2 laser and they shot it through, for lack of better terms, they fractionated it. And so it's like shooting it through a colander, right? Through like a spaghetti colander, to where you get that single beam is broken up into millions of little tiny beams. And then, so what happens is you only treating part of the skin and you're leaving part of the skin behind. And that part that left behind allows the part that's been treated to heal much quicker. And so that was one of the revolutionary steps in CO2 lasers when they went from a fully ablative, which is a single light source, and like a laser beam that, right? As opposed to now they're shooting it. You laugh at me, but
This is always it's always our Star Wars. It's always our Star Wars
Andor
laser
starts this week.
beams.
You gotta go watch it. Well, that's my son. But they're shooting it through a colander, so you're getting around 90% of the effects, 80 to 90% of the effects with 10 to 15% of the downtime, which revolutionized and brought CO2 lasers back. And that was really in the late 90s and 2000s that fractionated CO2 lasers kind of made their comeback, right? And look, in plastic surgery and aesthetics, it trends, right? You know, I mean, like big butts were in, big butts are out, big boobs
Big
are in,
boobs.
big boobs are out. And it goes back, the pendulum, it's like skinny jeans are in.
Yeah.
You know, bell bottoms are now out, and then all of a sudden,
Look
bell
at you
bottoms
with
are
the
back.
fashion.
Oh, I don't
My wife
know.
has
I
more
mean-
pairs of jeans, and I mean, it's insane. So, and like, it changes weekly, right? You know?
And like after the Super Bowl, bell bottoms came back hard.
Yeah,
I know.
like
Isn't that
hard.
crazy? How does that happen?
Like,
so,
hard.
but yeah, so I like skinny jeans, but I'm not a bell bottom kind of guy. But same way. So you know, but the fractionated CO2 laser kind of restarted the CO2, and you're right. So you know, to me, it's an essential component of a facelift or a facial rejuvenation, right? Because, you know, and that's why estheticians are so important to the practice, because really, I mean, taking care of your skin is hugely important.
It's so important.
So important.
I see a lot of patients who really dedicate a lot of time and money to fillers and Botox and neglect their skin.
Yeah.
And you don't have somebody that walks up to you and says, oh, your Botox looks so good. They're
No.
going to look at your skin
Right.
and look at your complexion and say, wow,
Right.
you have like childlike skin. You're gorgeous.
Right.
You're glowing.
Right.
So it's really important not to neglect your skin.
I think so. You know, I think men and women see women through different filters. Does that make sense? You know, men are much less critical of women than women are critical of women, or women are critical of
think so.
themselves, right? And so men, in my mind, look at women in shape, proportions, and, you know, certain kind of features, right? Women, like, I mean, it's like skin, hair, teeth,
Nails,
right?
everything,
right?
what you're wearing.
It's
We
those-
stress
Yeah,
so much
that's right.
about outfits
right,
and
but
stuff.
skin is such a huge component of how you present. And you're absolutely right. People come in and they want to do all these other things, but you know, they don't want to take care of their skin. And you see it coming from, you know, a more rural area, the tanning, like
yes,
the sun,
a lot of
the-
sun
the
damage.
sun damage, and the
In South
home
Louisiana.
tan beds. Oh,
My
yeah.
my gym still has tanning beds.
Yeah,
Really?
you're like, who
The
does
gym sells
this?
tanning beds?
They still have tanning beds.
I don't even know if that's legal anymore. To tell you the truth.
They still have tanning beds.
It's crazy.
I just thought that was the most
I always
insane
tell
thing.
protect your investment, right? So you're
Right.
spending
Yes.
thousands on things that, you know, whether it be a facelift or
Well, and I think the other thing is, all right, so like, and maybe I'm wrong here, but I say this all the time. Most people see themselves as 18, right? Like for some reason, we grow up and like your picture of yourself is locked in when you're like a senior in high school, right? And your perception of who you are, what you can do, what your limitations are, and how you look is how you are in high school. And I know this sounds crazy, but like I see it all the time in ladies, like, and this, I'm not trying to be nasty, but like a woman comes in and like maybe she was in high school known as the girl with the big perfect breasts, and she's obsessed with having.
She holds on to that.
Like the girl with the perfect body, right? And so she like has to have the perfect body, and she's not necessarily worried about her face.
Yeah.
But I think what happens is, you see your face as, so you're in high school, and all of a sudden you wake up and you're 55 years old, and you've been laying in a tanning bed. You go into Gulf Shores, laying out like crazy. Eating poorly, not using good skincare, not seeing an esthetician, and you freak out and you think all of a sudden you need surgery. Well, you may, but what you really need is to pay attention to your skin, right?
Correct.
And that's where Connie comes in.
Yeah, it's so important to have a good, healthy skincare regimen. Using your sunscreen, it, like Taylor said, it's easier to, you got to protect your investment. It's easier to protect now than correct later. Because then you have to invest. You have to invest in the lasers and the chemical peels and the Botox and the fillers and the surgery.
Right.
So to treat yourself on the front end and take care of yourself is really important.
So I'm going to put you on the spot here real quick before we get into CO2 lasers. All right, if somebody comes in, give me a quick little snippet of what you can do if you're 20, if you're 30, if you're 40, and if you're 50. Does that make sense?
So we start all of our skin consultations with a Vizia skin analysis. It's a high-tech imaging device that can tell us, it can tell us about the skin's health, the condition that it's in.
Right.
From there, we make recommendations.
I love the Vizia. I always say it gives you an age of your skin, and that's always they're
And a
like,
picture. It's an
well,
actual picture, right?
yeah.
I was so happy. I was just so happy that my skin wasn't older than I was.
Yes.
I felt like that was a huge accomplishment.
Yeah.
That's
like,
one of the things that the Vizia tells us that not all patients are pleased with, because it's a reality.
Yeah.
It's like, wow, I thought
Slaps you in the face.
Yeah.
It really is.
Wake
It's a
up.
check. So it's one of those things where like, wow, we have some room for improvement
Yeah.
here.
A lot of room.
And so we start with that, and then we're able to assess what we're dealing with. If it's a 20-year-old, we're working on that skincare. We're getting that retinoid. We're getting that sunscreen.
Just getting that pattern going.
Yeah,
20, right?
maybe some light exfoliation. 30s, 40s, we're starting to talk about that laser resurfacing, that IPL for early signs of aging and that pigmentation change. And then we're going into 50s and 60s. We're talking about it all at that point.
Yeah.
Filler, Botox. We're talking about surgical procedures. Lasers,
Getting more
ablative.
aggressive,
We
getting
are,
more ablative,
yeah.
right?
Yeah, it's super important.
I always tell patients, as you age, you have to turn the dial up a little bit, right? What you were doing in your 20s ain't going to cut it when you're 50, and you have to get more aggressive. You have to use these energy-based device. So talk to me, Connie, about how, because we're going to talk about, let's kind of break it into two. So we'll talk a little bit about CO2 in general, and I'll give my little spiel about how I use it, and then we'll take a little break, and then we'll come back and talk about how you use it with your cool peel and stuff like that. But how do you explain a CO2
I know. I
laser,
think it's a little
right?
confusing
Like how do you
that
explain
they're
that?
both
that they're
a CO2, but they're so very different.
So very different, right.
So cool peel, I feel like it would be for you and I. So it would be light resurfacing. It's going to help you with pores, fine lines, wrinkles. It's more of a resurfacing laser for light, mild aging. I think for Dr. Weiler, his ablative is going to be for, those deeper deeper wrinkles, more pigmented skin, that textural where you see those large dilated pores. It's going to be more.
So we're going deeper.
Yeah. So what
you're
I
more like
I'm superficial.
surface.
Yeah.
Correct.
So think of it as in a CO2 laser is great because you can really adjust the intensity of this laser, and you can adjust how it penetrates, how much
The
patterns and things like that. So what a CO2 laser does is, so in my hands is a CO2 laser, it targets water in the skin. And so it's like this, and I always use a fractionated laser. So I'm always shooting this laser, this beam of light through a colander and breaking it up because it's far too aggressive in my hands.
That is fractionated versus unfractionated.
Correct.
Is how it's spread basically whenever it hits.
Like that colander versus that
Right.
straight beam. Yep.
colander
And you
versus our Star Wars
Yes.
beam.
Yes.
And you can increase the density to
can-
make it more aggressive.
Correct.
Yeah.
And
Yeah.
you can, so if somebody comes in and, they're a younger patient, let's say they're, late 40s, early 50s, that's really when CO2 starts to come into play aggressively. We can, like Connie said, so in density, what's that related to is how many little points of light you get in in a square, right? So you can take this little wonderful card we have, and you can say,
We're
you
fancy
can,
now,
right?
guys.
You can do 5 little points of light in here, or we can do 200 points of light in here, right? And the greater the density, the more ablative it gets, the more damage, and I'm going to say that word, the more damage it does, and the more it takes off those 200 little layers of skin. You're still leaving behind a live, viable, healthy skin, and then your skin heals in from those healthy areas. So what it does is that beam of light focuses in, and it really targets water, and it heats that water up very quickly. And what that does is it basically, and my derm friends are going to rip into me, but I like to make things simple. So skin is 2 layers, top and a bottom, epidermis and dermis. Top is what you see, and bottom is what supports it, right? Your top layer, when you're young and beautiful, is really thin and really nice looking. And your bottom layer is really, really thick, okay? So what happens, and this is a very simple way of looking at it, but as you age, your top layer builds up, and it gets, crepey, and it gets pore damage, and the pores open up, and you can get some pigmentation issues. But think of it almost like scales on a snake. And your bottom layer sort of thins out, and that's where your collagen and elastin, and that's really your supportive layer. And what a CO₂ laser does in a very simple fashion is when it heats up that water, it ablates or blows off that top layer of skin. And so it takes those multiple layers of skin and kind of brings it down to just a fine few skin cells, like baby skin. You get a little pink baby skin going on,
That
right?
just-
Just sort of boom, takes it off. And it's, and my wife hates when I say this, but it's like a sander, kind of
Yeah,
sanding
it
down,
is.
right? Sanding down that top layer. Now, there are lots of devices that can do that. You can do that manually with dermabrasion, all kind of stuff. But it works really well with a CO₂ laser. But it also penetrates into the bottom layer and causes some damage. And I'm going to use the word damage because you have to penetrate into that bottom layer. You have to cause damage to stimulate the growth of collagen and elastin. And that's when that growth starts to occur. And Connie, as an esthetician, has a couple different ways to do that. But we know to get that to grow, you have to penetrate into it, right?
Correct. That's what aesthetics is all about,
Right.
is stimulating collagen and elastin
Right.
through a controlled injury.
Yeah.
Right.
That's essentially
Yeah,
what it is.
that's
And
it.
so
Right.
when we're vaporizing the skin, yours is a little bit more aggressive than
Right.
mine. Mine is where we're talking about just a few of those little dots.
Right.
Yeah, it's easier to recover from. And
Yeah.
a lot of patients that are younger don't need extreme downtime.
Right.
They don't need extreme resurfacing like that.
Right.
So that's where the Cool Pill comes into play is, just a nice refresher.
Yeah.
I'm actually working on my mom right now. She probably needs
Hazel.
more.
She's probably listening.
She needs Dr. Weiler, but she's letting me,
No,
do
you gotta
the,
look. And so what I do, I typically, it can be, so in my hands, it can be a standalone procedure, but it's typically combined with facelifts. And it is, people like freak out. Am I gonna do it at the same time as a facelift? It's an excellent time to do it because you're gonna have downtime anyway.
Yes.
That's right.
All right. And I tell patients the face is really a miraculous area of our body where you can really beat it up hard and it comes back. And if you beat it up with multiple procedures or you beat it up with
All
one
at once,
procedure,
yeah.
it doesn't matter. The recovery, it still fights back just as quick.
Yeah.
And so almost every recovery except lower eyes is around 5 to 7 days on the face. And so it's a perfect time to say, hey, we're going to do a procedure and then we're also going to layer this laser on top of it. Because I tell patients, no matter how hard you pull that skin, you're not treating your skin. You're not treating it. So, you can pull all day long, you can make it super tight, but then you still have the same skin.
Yeah.
And I tell this all the time on weight loss patients, and this is a good way to understand it. So I do a lot of tummy tucks on weight loss patients. And those of you that have lost weight usually have a lot of stretch marks, got a lot of excess skin, right? I literally put those patients, legs up, back up, like a jackknife almost. And I'm like,
Pull as tight as can.
pulling that skin as tight as I can. And literally you can't even almost lay them down. And they come back a month later and it's a little bit loose again because the skin is damaged. Now we can't CO₂ the belly. The skin won't tolerate that, but we can CO₂ the face. And so it's an excellent opportunity to do it. And as a matter of fact, on lower eyelid surgeries, a lot of times I know that skin pinch is all the rage, right, online, and I do a lot of skin pinches, but on some patients, you don't even have to do a skin pinch because you can tighten that lower eyelid skin.
Have you seen that on social media lately?
The
Everybody
CO₂?
is. Yes.
Oh, really?
Got
It's
that,
back in?
that full dramatic
Okay.
tissue retention.
And we've been doing that. Hello.
Yeah.
I know,
Yeah.
but
It comes
ahead
around,
of ourselves.
right?
Yeah.
And we've been doing CO₂, and so I love it on the lower lids. But yeah, so my algorithm is a patient that typically can be standalone. Typically, my patients are like 45 or above. I love my older patients that are 70s that I can just turn it all the way up. One of the issues with CO₂ laser is you do have to be a little bit fairer. The fairer your skin, I tell patients, the better the results, the less the risks. And the risks of a CO₂ laser, in my mind, is hyperpigmentation can sometimes occur. It's an inflammatory issue from the resurfacing. You can get scarring because it is burning, but it's very, very rare to get that. That can occur. And then some prolonged redness can occur too. But typically my patients, I do it with a facelift. I'm very aggressive. I do multiple passes. We'll go, and each pass goes a little bit deeper and deeper. I love it around the mouth. I love it around the eyes.
Perioral lines and crow's feet.
Yeah, because the mouth area, besides fillers, there is a crazy surgery you can do on the mouth. Like some of those ladies have had it. Joan Rivers had it done in the past. I think Reba's had it done.
Don't you talk about the queen.
I love Reba.
Don't you talk about the queen, sir.
I know, but you can make, so you can't really pull the mouth, but you can make a quarter incision and pull up, because this is a very, Taylor knows, this is a very tough area.
Yeah.
So I wouldn't recommend doing it. But
I just feel like I've seen it where it like puckers though.
It does pucker, and it gives you almost like a little Joker.
Yeah.
I was about
And
to
you
say,
have to
you
wear
feeling
heavy
like
makeup.
Joker?
Like you'll never see Reba without heavy makeup on.
Yeah.
Because of that, Dolly Parton had it done, and Joan Rivers certainly had it done.
All
It does
queens.
alter the appearance.
Do it.
Look, I love
All
them.
queens. Like, all queens, do it.
We're going to do a whole podcast because I talk about this all the time. Like Sylvester Stallone is like 80, isn't he? 80.
Yeah.
Now look, he looks a little crazy.
He looks a little cray-cray.
But let me tell you something. He looks good. You take a normal 80-year-old person and you take Sylvester Stallone,
Truly.
who is still on TV, still making movies. There's something a little odd look about him, but he still looks good. It's odd good. And I tell my wife all the time, like at some point when I'm like 76, I'm going to start looking a little odd. But I'm still going to look good, baby. It's going to be a little odd looking. It's not going to be looking like, because look, you can't be
You're not going to be able to pinpoint it.
Yeah.
But something's going to be
You
there.
can't be 82 years old and still look good and still look like yourself. Like I pull that off. I'm very natural. Like you start getting in your 80s, you know. So he looks great. But anyway, we're good on topic. But so CO₂, I love it around the mouth. I love it around the eyes. I love it around the whole face.
Going back to the mouth.
Yeah.
Lip lifts. We need to talk about that for an episode.
We will. I just did one yesterday.
Did you?
Yeah.
Lip lifts are big time coming in.
Right.
I mean, I feel like they kind of wax and wane.
They wax and wane. You got to be careful with them.
They're in right now.
They're in, I think, because it's a scar. It's a scar that hides well on most people, but even on, you got to be careful with it. You got to have a longer lip. You got to give you that lip roll. It is a skin-only procedure with a lip lift, so you got to be careful about the effectiveness of it. There's certainly an indication for it. It's not something I would typically do on a younger patient, unless they have like a real measurement off.
Well, that's what I was going to say. Remember we talked about this? Maybe when we were talking about lip filler, how like it elongates like this. Is that where these lip? No, we're gonna get real sidetracked.
You don't want this to be too long.
That's what I'm saying. So that's what we're
you can shorten it,
which is why you're saying on the older, like in an older population,
it stretches out.
and like pull it back up.
But like these young people come in like they want to. We already call it buccal or buccal, like these buccal fat removals.
Right.
Don't want to do that when you're in your 20s and 30s. I saw 3 patients this week. They didn't have that done, but their biggest complaint was they were so slim through here, and it's not a whole it's hard to rebuild that from a filler or a fat injection standpoint.
Wow.
But getting back to the CO₂ laser.
Right.
So the CO₂ laser works really well around the mouth because there's not a whole lot you can do surgically around the mouth. It's mostly volume or it is lasering. So I do a fractionated CO₂ very aggressively with my patients on facelifts. I use an Aquaphor post-op. We do that for a day or two, then switch to an Elastin or to another product. But I do like the Aquaphor for the first day or two because You can just coat a lot of it on there, and it's cheap and it protects very well. You will get pinpoint bleeding with what I do. You will get massive swelling with what I do.
I mean, let's not sugarcoat it.
You will get swelling.
You
look like
scary.
a pumpkin head. You look like
scary.
But it's amazing.
Now, well, what
How long am I a pumpkin head for?
3 days.
Okay.
3
I
days,
could do
really.
anything.
3 days.
Pretty
That's
much
the
back to
weekend.
normal. Your skin heals
Yeah,
really
quick.
Really
fast.
fast.
Right.
So
Right.
within 10 days,
And the other reason you're
looking
kind of a
good.
pumpkin head is because I numb the face up. So a lot of people put you under general anesthesia and they do the laser and you wake up, you're like, my face is burning. No. I do this under Valium. I numb the face up.
Which is medicine by mouth
Which is
only.
medicine by mouth, right? And then I numb the face. So I do it while you're semi-awake, so you don't wake up in extreme pain. And I never have complaints of pain afterwards.
yeah, everyone
Yeah.
post-op, they always
Never.
say, it's
They
not
look-
painful.
Yeah.
I
Yeah.
look terrible.
Yeah.
They
You look
look like
terrible.
they
Yeah.
walked
Yeah.
through a fire.
You look like you look like I beat you with a baseball bat or
Yeah.
a zombie. I mean, you are swollen, you are bleeding, you are red, and you're slimed with Aquaphor.
Yeah, the Aquaphor
It
makes
is
it even
not-
worse.
It is not a pretty look for a day or two. But it doesn't hurt if you do it that way. And I think people read online, they see social media, and pain is like a huge fear.
Yeah.
And I understand that. But and so I can guarantee my patients no pain. But I do.
I would
guarantee-
definitely second that.
Yeah.
They look scary,
They look
but they're
scary.
fine.
Yeah.
Like I did my wife's. I did my wife's twice. I've done my mom. I did my mom, and I don't know if you were there. I rolled
Oh
She
my
hasn't
gosh.
forgotten that.
Huh?
She hasn't forgotten
No, she
that.
hasn't.
Well, do you remember his dad? His dad was like, Jonathan, what did you do to your
He almost
mother?
started crying.
He was so upset.
And I have had a patient who she was getting picked up by her granddaughter, and you were there, I think. And I did a CO2 on her, and we rolled her out. Her granddaughter looked at her, screamed, and ran.
Yes.
She ran 2 blocks. We had to go pick her up. We had to literally.
Yeah, she's fine. She's fine.
She's
She's
fine.
fine.
She's like,
She's fine.
Baby, come back! it was like something out of the Goonies with Chunk, you know.
Yeah.
I think it's a huge shock for husbands. It
Oh,
really
it's a-
is.
because they don't.
They're like, what did you do to my wife?
All of a sudden, they're told the night before, "Hey, you got to pick me up tomorrow. I need you to get off work."
I was about
and
to
pick me
say,
up
that
at
goes
noon."
on the wife for not informing the husband.
And so I always tell, like, literally, like the husbands are in there, and I'm like, and I always want them in there before I start, like, because before we bring them back, and I'm like, your wife is going to look like a monster.
like-
And they're like, no. I use
No,
the
like,
word
I need
monster
you.
specifically to say monster.
It's like, have you seen the
Yeah,
Goonies?
have you seen-
Have you
yeah.
seen the
Have
Goonies?
you
I
seen
wanted
the-
to
Yeah.
reference
They will be
here.
fine.
They will
but-
be fine
They're
in
fine.
2 days. But today, when you pick her up, she's going to look like a monster.
I feel like Josh would just be like, "Would you? I don't even want to know what you
and
did.
the husbands are
I
like
don't
that.
even want to
But
know
some
what
of
you
the
did."
husbands are like, and I literally, that little girl, she was like 19, ran 2 blocks. We had
That
to get a
is
car, go pick her up.
hilarious.
It was crazy. It was crazy.
That's
But
fantastic.
no, the CO2 laser in my hands is a fabulous device. It does have, I tell patients, 3 to 5 days you can put makeup on. You can cover it, and it is a wonderful device.
Okay, I think you're being a little short. 3 to 5.
5 days of makeup.
7.
7 days?
Seven.
Of makeup? Okay, so we have
At-
estheticians.
At minimum,
We have
7.
estheticians come in with makeup
Yes.
at 5 days. But I do tell ladies, so it's about a week. Everything's about 5 to 7 days with the face. Now, you
Yeah.
can have some prolonged redness.
Yeah.
It always goes away, I tell patients, but you don't know when it's going to
Is there
go
any
away.
bruising or anything, or is it?
No,
you know, like
it's-
when you're saying
it's-
like the swelling and the redness and the bleeding and stuff like that. Is there?
It's not really bruising.
No.
I mean, if you have a facelift
there's no-
with it.
Right.
But
Yeah,
no.
this
Right.
is. I'm sorry, without the facelift.
Yeah.
If
just with
anything,
the laser.
if you're just doing the laser, if
No.
I'm numbing you, you can bruise some of the numbing medicine.
Yeah.
Yeah.
But you won't have any. You don't get any bruising from the procedure. You'll get a little pinpoint ooze. You'll get massive swelling. You'll get redness.
It's like a little crust,
Yeah.
basically,
Crust.
that forms.
It kind of
that
crusts on
that
there.
tight, that tight.
Yeah.
Yeah,
But then that sloughs off, and that's
Yeah.
the annoying part, but you're fine.
you're fine.
Well, I mean, that's no different than any other time we're
Yeah.
sloughing skin off
Yeah,
of our face.
truly.
Like,
Yeah, and
Yeah.
you're absolutely right.
Yeah.
You just aggressively sloughing off a lot of skin.
Yeah.
You
Yeah.
know, when you do the laser, it actually vaporizes that top layer
Yeah.
of skin.
Yeah.
So we actually have a suctioning device that's pulling that plume of vaporized skin out of the air.
And he said, I mean, kind of something scary earlier about scarring. That is for somebody who is the wrong patient.
Correct.
They have
Correct.
a history of keloiding
Correct.
or scarring.
Correct.
I mean,
and
we're
the
going to do
condition
a,
of their skin.
Yes.
So we,
Yeah.
as kind of like our insurance, we're pre-treating all
Yes.
patients. My patients, Dr. Weiler's patients, with pigment suppressing ingredients in the
Yep.
products. We are encouraging a healthier skin barrier.
Right.
So you can.
You have to be prepped going into this procedure.
Yeah. Better
and our
outcomes.
estheticians
Yeah.
work with you.
Yeah, the scarring issue is, you'll see online on social media, some people doing CO2s on African-American skin. I do not advise that. I would never do that. That's where that scarring can come in. The keloiding. We have had some issues with a little bit of pigmentation that's been difficult to deal with, but we usually knock it down and get that cured off very nicely. I've had one patient that has had prolonged redness. When I say prolonged, somewhere between 3 and 6 months, which is covered with makeup, and it did go away. But that's tough, obviously, to have that. But everyone else, I do a ton of CO2
You do
lasers.
a lot of CO2.
And I love me a CO2 laser. I love it. Let's take a quick break.
Yeah.
And then we'll come back and really focus in
can
on
we
Connie's.
focus on...
I've been dominating this
No, I
conversation.
love that. It's great.
Well, I think it's good to know the difference.
Yeah.
Because we're about to
Absolutely.
get into a whole nother.
Right, and it's important to know there is like the in the surgeon's hand, it's a very aggressive downtime. And then
so
in
when
the
you hear
esthetician's
CO2, it's not immediately like monster.
Correct.
No,
Correct.
Connie's not going to make you a monster.
She's not going to make you a monster.
There you
Not
go.
at all.
Not gonna make you a monster. So we'd like to thank our sponsors. Weiler Plastic Surgery Group, the largest aesthetic practice in South Louisiana. We've got practices now. We're about to open in Lake Charles. So we've got practices extending across Southeast and Southwest Louisiana. I also like to thank Rejuvime Medical, Louisiana's largest anti-aging group. They provide hormone optimization, testosterone replacement, optimization for women with estrogens, progesterones, and testosterone. They also do GLP-1s. And stay tuned. We'll be right back.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I had gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, we are back and we are going to dive into a different type of CO2, and Connie is going to guide us on this journey and kind of tell us about it. So obviously, we just got done listening. Dr. Weiler giving us the full rundown on the CO2 that the surgeons are doing. Are you doing that in the OR?
Yeah, we do it. We typically do it because we're going to do a little sedation. So we're doing it in the OR.
So doing it in the OR and all that kind of stuff. Now,
but the beauty of it is that it is no IV, no general anesthesia.
Like
he can do it. Just taking some loopy pills, and you're good to go.
And you're good to go.
So that's a big...
Just a quick dentist trip.
Yes.
Just a quick dentist trip. But now we're going to kind of like completely flip it around. Esthetician-wise, you, ma'am, have a tool in your tool belt that is also CO2
Yes,
Right.
thanks to Dr. Weiler. He always equips us with the best of the best.
Cutting edge.
The cutting edge. Yeah. So, he's entrusted me to do this fractional CO2 device on patients that is kind of dubbed the cool pill. And the reason why is it basically is... For what it does, it's very tolerable. It vaporizes the skin, but in little tiny fractional columns. So you're not having the downtime that you would with an ablative CO2. There is only about a 45 minutes topical numb. There are no medications involved with this because it is so superficial.
So driving yourself to the procedure and back,
Yes,
right?
absolutely.
But before we get into this, I just want to ask Connie, who are these patients coming to you? Who's a good candidate for this?
Right.
Like, what type of skin are you looking at going, you know what, CO2?
Yeah.
cool
So
pill would be for
this
you.
is ideal for somebody who is already maybe conditioned with their skincare, who may want to just kind of take it up to the next level. They've already tried maybe Genius RF, which is our microneedling devices with radio frequency, and we're ready to maybe up the ante a little bit.
Yeah.
So this is not a first-time patient walking in the door.
It can be.
It can be.
It can
But
be,
traditionally,
but,
it's more
you know-
Anything is possible.
Anything's possible.
Yes, but
Anything's
you have to really make sure that you're choosing the right patient for this, because we're pre-treating the skin, they have to also commit to being out of the sun.
Yeah.
It is imperative.
That is a big
to have.
This is a winter treatment.
right.
Yes,
Like,
if you're
look, if you're 50 years old, you should never
You're
have your
probably
face.
not.
You
Yeah.
should
Right.
never
No.
have your face in the sun. Right.
Yeah.
Right.
You should at the beach, big hat, maybe even a scarf over your
I want a
face.
sombrero.
Sombrero.
Yeah,
Right.
the bigger the better.
Right.
But you have to stay out of the sun, and if you can't commit to that, then
Yeah.
you're not a good candidate for
Right.
it. So I'm looking for 30s, 40s that are just mild aging has set in, and they're just looking for a nice refresher. I don't feel like any of us at the table really are candidates. So we could do it for full ablative, but maybe start with something like
Yeah.
Yeah,
CO2
start with you.
Yeah.
cool peel. Yeah. Something lighter. And also, some people are kind of fearful because, the educated patient knows what they're going to be going through with Dr. Weiler.
That's what
and
I'm
that
like,
fully
monster
ablative
living.
CO2. Yeah. And so
Zombie town.
it
I
may be
think
a
it-
good get your toes wet type of.
Right. I think of somebody fine lines,
Mm-hmm.
wrinkles, textural changes.
Right.
They don't have time in their life to be
Down.
down for
For a week.
for a week with a full CO2. They need quick, fast, in a hurry, need to get it in, but get back as soon as possible. Now, how many times do you have to do this?
We need to do it a minimum of 3 times.
3 times.
I feel like that's right.
That would
And
fit into my life.
That's the standard.
Correct.
If we're doing something, it's typically like 3 times. I
Yeah.
feel like everyone who's come on to talk to us
4 to
about
6 weeks apart,
Yeah.
Okay.
letting the skin fully heal, kind of bounce back, and then we hit it again. So it's you need at least 3 because again, it is so light. It's a sprinkling,
Right.
just a little
And
sprinkle
that's-
of
that-
skin slough.
We don't have a whole lot of swelling. We have mild pinkness. Within
Okay.
24 hours, you're starting to look back to normal.
Okay, so I come in and Connie, you're like, yeah, this is it. And so you said that you pre-treat the skin. Yeah. What are you doing to pre-treat? Is this the same type of pre-treatment that we talked about with like the CO2 that Dr. Weiler's doing?
Yes, we follow the same guidelines. One, we just want to make sure that we're clear across the board and be able to communicate that with all of our patients. It's so important. Safety first for all of our patients. So, we use pigment suppressing products. That basically means we are trying to sedate the melanocytes, make them go to sleep. So when we do these aggressive
What's a
lasers,
melanocyte?
That's a
they give us the pigment to our
That's
skin.
right.
So we want to make sure we're kind of calming them down before we start firing off these lasers on their skin. More predictable outcomes, and you can manage their expectations better.
Okay.
We don't have, if you just go in all willy-nilly, you're possibly going to disturb that pigmentation and cause, especially if somebody has melasma or prone to melasma, we really want to avoid that. So it's super important to pre-treat first.
so I've done my pre-treatment. What do I do? What do I do before my appointment?
So you come in, we're gonna cleanse and prep your skin, make sure everything's nice and clean, and then we're gonna topically numb you for about 45 minutes.
Okay, good, because I'm a what? Yeah, this is
Yeah.
we always say
Yeah,
it.
how painful is it?
Like I'm a wuss.
I honestly think I did it on the back of my hand.
Okay.
Without numbing. And I feel like it is probably the most tolerable laser device that.
Come on.
I'm not kidding, Taylor.
Well,
I know
no.
that you're
okay.
saying
I was
but,
about to say,
um,
is it more tolerable than Taylor getting?
laser hair removal.
Is it more tolerable? Than
Yeah, I do. I feel like it is. Now, obviously, the spicier areas are going to be on the forehead, as they always are with any device that we have. You don't have any tissue up there, so it's resonating off that bone. But when it comes to this, like the mid face and the neck,
This is a neck thing too. I love a neck treatment.
everybody
Love a neck.
neglects the
The
neck,
neck.
and
Yeah, I
they
love a
shouldn't.
neck.
People are
So-
afraid to treat the neck oftentimes too.
Yeah.
So,
I love the
a lot
neck.
of people come in that had a full CO. You'll see it CO2 to the face, and then do the neck and have this line.
Yeah.
It's
crazy.
and it's baby skin
Yeah.
and then aged
Yeah.
skin, and
Yeah.
you don't
Crazy.
want that.
Oh,
We've got to
wrinkly
blend
neck.
it
Yeah.
in.
Right.
Yeah. So when you're sitting in there, you're numbing. We have TVs. You can watch Netflix if you want, and then I come in and do the treatment, and it only takes about 15 to 30 minutes to do.
Okay.
Yeah, it's super quick. I could speed it up, but I like to take my time.
Yeah.
Yeah. And then what are you doing after? What are their
We
instructions?
need to make
hair.
sure that we keep the skin occluded, just like ablative CO2.
Okay.
We want to make sure that we keep their skin nice and hydrated. We want to do gentle cleanser, no makeup. We want to stay out of the sun. And then usually on day 5, they can start reapplying a clean makeup. I prefer mineral based with clean fingers, clean sponges, clean brushes. They might have a sandpaper-like feel for about, I would say, 5 days. But after that, they're good to go.
So I always wonder, like you say, gentle cleanser after makeup 5 days. A lot of people that we see when we talk about taking care of our skin, they're on all of these regimens, skin regimens on different things that they're using. When can they start using their like regular products, like their morning, afternoon?
I would say about 10 days.
It's like a little
for
bit.
a cool peel.
Yeah.
Now, we are sending you home with post-procedure products that we really want you to use until they're gone. It's really important to reestablish that skin barrier, and allow the skin to heal properly. So post-care, we talk about scarring. Post-care is really important.
Yes. Yeah.
Picking, scratching, exfoliating too soon.
People going home and like just, people, you never know what people do when they go home.
Yeah, that's really
the
important.
first peel that I ever did, I wanted to.
Yeah.
I wanted, and I.
You want to get in there and peel out. But
Taylor lets the skin flap when she has chemical peels.
With chemical peels, I'm like, let it go. I don't want to touch it.
We allow you to clip it down. When it comes to a chemical peel, we'll let you clip
hanging down below her
Taylor's
shoulders.
injecting with skin just flying in the wind.
I'm so sorry. Like, don't mind that. That's
Poor
just a piece of skin. Like,
She follows the rules.
that's what Taylor has.
Taylor's a rule follower.
That's why you have to be so good at injecting, because people are like, I don't know, she sloughs on me at times. I'm like,
Can you combine it with anything?
So you can have Botox the same day,
Okay.
But I would wait 2 weeks for fillers.
Yeah.
You can also do other things if the patient is just have to have a dermaplane. You could dermaplane the skin before if you wanted to, or pair it up with our other lasers. You can do Genius RF microneedling if you wanted to, and layer.
You could do that all one day.
Yeah,
That would be
on top.
amazing.
Now,
I'm
obviously, patient selection
Yeah.
is important.
Yeah.
It's not just for everyone, but it can be done.
That's
I love that. Stack it up.
So 3 sessions, 4 to 6 weeks apart. What else? Maintenance yearly.
Yeah, you probably, with anything, and
Yeah.
this is the biggest conversation that I have with patients all the time is, it's not a one and done.
Yeah.
It's not even a 3 and done.
Yeah.
It's you literally are just cranking it up
You've
with your 3 sessions.
Yeah.
We have to continue. If it's important to you, if this is your goal,
right.
then we need
It doesn't
to continue
stop
this.
here.
It doesn't.
It's
Yeah.
like buying a nice car. Like, I am horrible about this. Like, I don't get my car washed enough, right? My wife's car, my wife is meticulous about the car. Like with her car, washed. Like, I'm driving her car, don't get in the mud, and yelling at me, and so it's similar to that. Like, because she gets it washed. She has the membership over at Benny's.
I'm
right?
impressed with Elizabeth.
Yeah.
I did not know that.
She is meticulous about the car. So to me, it's like, if you want to get that, wow, your skin looks great, you need to be
have to-
meticulous.
yep.
And in my mind, I tell patients this all the time. You get above the age of 50, it is an energy-based device at least every 3 months. And Connie may disagree, but there's a whole
I agree.
slew. When I say energy-based device, it doesn't mean
Not the
a
same
cool-
one necessarily.
No, it doesn't mean a cool peel, right? It doesn't mean RF microneedling. It means it could be IPL. It could be an ultra. It could be something.
It could just be skin pins.
Skin-
Yeah,
Everything
Yeah.
has its own target. You're going to get a different result with every
But it's-
device
it's
that we
consistency.
have. And it's consistency.
It's every 3. If you want to stretch it to 4, but if you visit with an esthetician and I'm not just talking about dermaplane. Dermaplane works great. 30s, 40. You get in your 50s and you do an energy-based procedure with your esthetician. You're not going to roll out of there after your first one with this Morocco skin. You're not going to roll out after the 3rd one. But I guarantee you, in 2 years, people will be like,
What did you do to your skin?
Ooh,
Yeah.
do to
your
your
skin
skin?
looks great.
Yeah.
right? I mean,
Yeah.
kind of like you ladies are glowing,
But we use medical grade skincare, and
Yes.
that's super important because as an esthetician, I'm only seeing you once every 4 weeks.
Right.
What are you doing in between?
Right.
And so I have pushback, and you're like, I can't use that. I won't commit to it. But man, if you would,
Right.
you're taking yourself at
next
home
level.
to the next level.
It's the gym without the diet.
Yes.
It's the gym without the diet.
correct.
You're right.
Yeah.
You take your patients to the next level too, talking about overall health.
Right. Yeah, you're
Right?
very much into
Yeah.
gut health
I
and
mean,
health,
gut
yeah.
health and what you're eating and
Truly.
Which I gotta give it to you. You
and-
were like an early adopter, and there's big stuff coming out these days
Yeah.
about that stuff.
Yeah,
so.
I'm all about
Yeah.
you got to eat, nurture within, because your skin is your biggest reflection of what's going on inside of your body. And
your
I
lo-
love
it's-
Rejuvime because of that. Because
Yeah.
I mean, really focused on nutrition. It
Mm-hmm.
matters, drinking your water, and because when we're doing these lasers, the better hydrated you are. It's going after the water in your skin.
Yeah. Right.
You're gonna have a better result when you're hydrated, deeply hydrated. Yeah.
love it.
Which we all are doing really well with all of our coffees and like, just pounding.
We're making
coffee.
it.
We'll get there, Connie. We're trying. Okay, we
Good.
can't. No. Okay. Is there anything else that we're missing on
Yeah,
CO2?
Connie, anything
I
else you
know.
want to add in there? I mean, you really are,
Not
you're,
even CO2. It sounds like you are like the esthetician on the
mean,
forefront of things.
You need to just, if anybody's interested, just do a consultation.
Yeah.
I mean, going in for a Vizia sets up
Yeah.
what she
Correct.
sees on that device sets up your steps in the best
It's
process.
a different point of view. Back way in our humble beginnings,
Mm-hmm.
I could eyeball. I still can. I can
Right.
eyeball
Yeah.
and tell you
Yeah.
all the things. But when a patient looks at themselves on a screen and we flip it through all these filters that shows you the sun damage, the brown, the vascularities,
Yeah.
man, IPL, which is Dr. Weiler's one of his favorite
Yeah.
light-based
Mm-hmm.
treatments, which I still recommend to everyone. It helps with those vascularities so much, and you can really see that first person on the Vizia skin
Yeah.
analysis.
Yeah, and I think the key is like how we see ourselves is not necessarily how others see ourselves. Does that make sense? And so, doing the Vizia and taking a step back and having the pictures and the program and your esthetician insight saying, hey, this is what you need to do. Because some people come in thinking I need X when you really need Y, right?
Correct.
And so
And it's overwhelming, right?
Oh, it's
Before you
very
know
overwhelming.
what to do.
so many products, especially with social media, all this crap that's thrown at us constantly and pivoting
TikTok
back and
shop.
forth.
Oh,
Yeah,
TikTok
the
shop.
Oh, the
and
TikTok
and the other
shop.
thing, because you have to give things time to work.
Yeah.
Absolutely.
You can't constantly be neurotic and doom switch back
Yeah.
and forth. And so, we've got a bunch of great estheticians throughout the state. Connie A.S. is I can't say it on the air, but it's definitely my longest tenured. And definitely one of the,
OG.
like she's
I like
OG,
you say
always, top esthetician in the St. Tammany
Yes.
area, always elected many years in a row, and extremely knowledgeable. I've got, estheticians, Connie really has a drive for perfection and for knowledge in the skin, which has never died. And so she's always harassing me about new devices and new peels.
next new thing.
The next new thing.
Always.
And so, and she will, and Connie's also very, very serious about it. I say it's like when you buy a house, do you want a real estate agent that, oh, it's my side gig, or hey, this is my full-time
I'm invested
dedicated,
in
I'm
this.
invested in this.
Yeah.
And we are invested in this. So getting with an esthetician, getting the Vizia,
Yeah.
getting that medical grade skincare. You don't have to go wild. You don't have to buy 15 products, right?
No,
not at all.
Getting
No.
your core products. And then if you're at that age, 45, 50 or above, saying in your head, hey, I've got to do an energy based, I've got to do a procedural thing every few months, a little more aggressively if I want to get to that next level.
Exactly.
I had somebody ask me, this was I think last week, somebody asked me, Brittany, your skin looks great, what do you do?
Right.
And I'm like, there's no reason for me to tell you what I do. I was like, because it's not what you're going to do. And
Yeah.
it's not, I was like, my best advice is I'm like, go to somebody who can
Yeah.
tell you what to do. I was
Yeah.
like, because I can't.
Right.
Yeah.
And I think that it's everybody's
Develop
like,
a
well,
relationship.
Yeah, like,
and
what are you
stay
doing?
It's
I'm
like
like-
a workout regimen, what do
That's
you?
what I'm
How do you
like-
look so good? Well, I wake up at 5 a.m. and
Yeah.
I work out and I eat macros and micros and I
That's
eat
what I'm
chicken.
like. But I'm like, whatever's working for my skin is not going to work
Right.
for
It's not a
yours.
one size fits
No.
all.
Yeah.
No,
And
and
so, like, that's why, like, that esthetician relationship is so
It
important.
is.
Yeah.
It is.
And I'm like, I tell her all the time. The girl who asked me about it. I said, listen. I was like, I go to Denham. I was like, and I know you live in Baton Rouge. I was like, and I know it's
No,
only
find
like
that practitioner
Yeah.
that
I
you
know it's
love.
only 7
Yeah.
miles. I was
Yeah.
like, but I'm like, this is where I go to do it. I'm
Right.
like, and this is what you can get.
Yeah.
Right.
So I do think that relationship is so important.
Con, so special to have you on today.
Yes. Thank you for
you.
braving the
Fun.
rain. She drove through rain to get here. So thank you.
did.
We are at the Weiler OG table.
I know, it is. It
Yeah,
is.
it's fun.
So, but no, Connie, thank you so much.
Thank you for having me.
This was so fun. Remember, everyone, follow,
Subscribe.
subscribe, do the things. We're on all the
Ding, ding.
platforms now, so make sure to take a listen to us. Follow us on Instagram.
Yeah.
I know we did a giveaway.
Yeah.
So I'm like, follow us on Instagram because we could do
Yeah.
more.
Yeah.
And get all kinds of fun
We got
stuff.
lots of fun stuff planned for the future.
Yeah, I'm like a more decorated studio. It's coming. It's gonna be great. So make sure you follow us on all those kind of things. Always stay curious. Always stay informed, and remember to always consult before you cut. We'll see you guys next week.